So feeling dizzy, decreased appetite. So as we're seeing now, the vaccines have officially arrived in the country. You're seeing that right there on your screens. The time is finally here. We were all hoping that they would arrive at 7 o'clock, but it's still exciting. It's still a great day to be alive, a really great day to be Ghanaian. We're seeing there that we're going there to receive our vaccines, and all those people battling with certain health conditions, all our frontline health workers are going to get this vaccine. And I think we should all be excited. Send those messages in. We want to know how you're feeling. The number again is 0550-585-832. If you're outside Ghana and you're experiencing this glorious day with us, please use the country code +233 for us to receive your messages.
Absolutely. So there you have in your shot, you can see the airport workers by the aircraft. The Emirates aircraft has arrived. The vaccines are being taken off the airplane, and I'm sure that we're going to be seeing a ceremony very soon, which the authorities will be speaking to us. So we'll be joining them there very soon. Jafar, you were reading earlier about allergies.
Yes.
I just wanted to make a comment on allergies, just to put people at ease. They said that one of the things Jafar read here said that if you're somebody who has had, strong allergic reactions, or you have strong allergies, it's definitely a cause for concern as far as the vaccine is concerned. Now, an allergy is simply the body's reaction to something that it considers as a foreign substance. So your immune system is just kicking into gear to say, I don't know what this is, I don't trust it, I'm going to deal with it. And sometimes our bodies overreact, okay? So I think it's important for us to bear it in mind. That's why we are going through, all the issues here, so that you'll be aware of what it is that are the possible side effects. But you can see on the screen there, I'm sure those are the boxes of the vaccines that have been offloaded of the aircraft that we're looking at. You can see some brown boxes wrapped in cellophane.
Yeah, and I think we should all be so proud of ourselves as a country. A lot of people underestimated us in the very first, the beginning of the coronavirus. People sent out articles about how Africans will die in their numbers.
In the streets.
We're surviving, we're thriving, and finally the day has come. And as you can see there, our first batch of vaccines are being, it's in that truck. We can physically see it. We can see it with our naked eyes. We have some of our top officials there going to receive these vaccines. We've done well as a country, and I think we should all take this day to celebrate, one, being alive to see this happen, two, being able to stay on top of the virus. We know that in certain countries, hundreds of thousands of people have died.
Yeah.
We've not gone through that yet. We have countries where millions of people have tested positive. We've not gone through that yet. We're still on top of it. So we may not have the resources that other countries may have. We may not have the monies, the human capital that they have, but we still have something as Ghanaians, and that's the grit and the resilience to keep going when we don't even have enough. I remember just the early days of COVID, when certain countries closed their borders to us, when we couldn't import basic PPE into this country. And some people were worried that how are these people going to survive now that they can't import? And we all got up and answered. Our entrepreneurs started manufacturing sanitizers. They started making face masks. We were each other's keepers. And I think today is a great day to celebrate the small gains we've all made as a country. To be able to receive our first batch of vaccines less than a year since we started our fight with COVID-19 is a great, great gain for all of us, and we should embrace it with the positivity that it deserves.
Absolutely, absolutely. Great scenes there. And as your messages are coming through, let me just quickly read a couple more. Good morning, David and Jafar. In my view, I think that many people require deeper education on COVID before they accept it themselves. all their children to be vaccinated because they don't believe that COVID exists, but rather rather that it's a planned move by the current government. Can you believe that? It's interesting. And then it says here, can you imagine many people prevented their children from attending school yesterday because they heard there was an ongoing vaccination exercise. Wow. Vaccination exercise before the vaccine has arrived. Very interesting. This is coming from Yendi, from Abdul Rahman Mbo in Yendi. Thank you for sending us that message. We appreciate it. Social media has already put fear in us. There are several viral videos circulating around. This is Mohammed Izzeddin from Eastern region in Achem Oda. Yes, it's true. There are a lot of viral videos going around purporting all kinds of things. I think that we need to, in this day where everybody's just quick to forward, when you watch something, quick to forward, press the forward button and share, we need to try and restrain ourselves a bit. If you watch something, watch it once, twice. Ask yourself a few questions. Where is this coming from? Who is behind it? Who is possibly behind it? Is there anything that suggests that there may be some untruth in what is being said or shared? Okay, you have to investigate it. Don't buy and believe everything that is being shared around on social networking platforms, especially. All right. Buddy from Ajumaku says, I really like the show. In fact, the publicity around the vaccine is very low. The authorities need to do more public sensitization. Greetings to Anthony Kwesi. Anthony Kwesi Saki, that's the Central Regional Youth Organizer. Yeah, so yes, this is part of what we are doing, educating, informing, advocating, and yes, the institutions like Information Services Department, the Ministry of Information, as well as the NCCE, we are encouraging all of them and asking them to ramp up information, ramp up advocacy, ramp up awareness so that people, we kill the disinformation that's going around and the conspiracy theories that are being spread about.
Yeah, and I also think that there are different angles to this and different stakeholders that are involved in this whole process, right? So one stakeholder is the FDA, Food and Drugs Authority. They've done their part by ensuring that these vaccines are going to be safe for all of us. The second stakeholder has to be the government. They have to do the best they can to educate all of us on exactly what these vaccines are. And as you can see there, we are moving the vaccines from the airplane to the VVIP lounge where our officials are going to receive them. So it's a beautiful, beautiful experience. I am so happy that I get to see it. I'm sure you at home are so happy. And I just want to see the look on the faces of our officials when it finally gets to them, because this is something that we've been waiting for months. People have been asking for months. When are we going to get our vaccines? The last time the government spoke to us, the president specifically said that come March, most of us will be going through the process of being vaccinated. And you see here the first batch of our vaccine. So today is a beautiful day to be alive. Today is a beautiful, the doses are 600,000. For a small country like Ghana, somewhere in West Africa, to pull this off, we should all be proud of ourselves. And I know that our healthcare workers, especially the frontline healthcare workers whose families are always praying and crying that they'll come back safe, will finally be able to sleep tonight knowing that they are going to get vaccinated. Those of us who have family members with underlying health conditions are going to be relieved. And as you can see there, our officials are walking towards where the vaccines are. I can see some
diplomats. Can you recognize them?
The diplomats there. I'm really looking forward to seeing the Ghanaian officials amongst them as well. It's impressive that they're there. I mean, I think I see the British Council High Commissioner there. But it's really a big day for Ghanaians that we pull this off. And of course, I'm sure we had to rely on some of our diplomatic friends to make it possible. But to even have the audacity to do that is beautiful.
Yeah, so let's. So we said that earlier on. We're saying that the people who are going to be receiving the vaccines, we're looking at the priority groups. We're looking at elderly. We're looking at health workers. We're looking at security personnel, the media, executive, legislature, judiciary, and high school teachers and students. Okay, so these are the people, the priority groups that we're going to be focusing on now. As Jifa said earlier, we have 600,000 doses of the virus, okay?
The vaccine.
Sorry,
It's okay.
the vaccine. 600,000 doses of the vaccine are what we are looking at over there.
And it's so beautiful.
I'm sure. Looking at
Can we take a moment to take it in?
Looking at the pallets that we're looking at there, I'm sure we're looking at probably 100,000 per pallet. Okay, or if it's 5, I think I'm looking. Okay, because you only see 5 pallets, so maybe it's 120,000 per pallet that we're looking at over there. But the total number is 600,000. Now the priority regions are Greater Accra region, Ashanti region, and Western region will be the targets for this first batch that have come.
And speaking of the regions, you know, Greater Accra region, we've had problems. We're a hot zone. So I want to, you know, caution people who are not in these regions from trying to come here for the sake of the vaccines, because more people are actually roaming about who are positive in these regions. So please allow them to be tested first so that we can move on with our lives. But I think it's just a beautiful experience for us to be receiving these vaccines. And of course, the Minister for Information has released a presser that we are going to read to you right now on the arrival of these beautiful vaccines. So it says, arrival of COVID-19 vaccines in Ghana. The government of Ghana is taking delivery of 600,000 doses of AstraZeneca COVID-19 vaccines made by the Serum Institute of India, that's Covishield, today, February 24th, 2021. This is the first consignment of the vaccines acquired through COVID-19 Vaccine Global Access Facility, that's COVAX, which Ghana, among 92 countries, has signed onto.
Absolutely. COVID-19 vaccination will be conducted in phases among segmented populations. The first segment of the population that will receive from the 600,000 doses will be health workers, adults 60 years and over, people with underlying health conditions, frontline executive, legislature, judiciary, and their related staff, frontline security personnel, some religious leaders, essential workers, teachers, and other personalities in Greater Accra Metro, including Ewutu Senya East in the Central Region. A similar segmented population in the Greater Kumasi Metro and Obuasi Municipality will also be covered.
So from the 2nd of March, the COVID-19 vaccine will be deployed in health facilities and designated centers in these geographical regions. The government of Ghana remains resolute at ensuring the welfare of all Ghanaians and is making frantic efforts to acquire adequate vaccines to cover the entire population through bilateral and multilateral agencies. We urge you to do your part by ensuring that you get vaccinated when the vaccines get to you. We acknowledge the hard work of the technical teams from Ghana Health Service, the Ministry of Health, the Ministry of Information, the COVID-19 Task Force, and all those who have assisted in getting us this far. Our development partners are also acknowledged for their tremendous financial and technical support. It is our hope that they will continue to support us in our sustained efforts in combating this virus and putting COVID-19 behind us. We have an audio for you. David, you want to tell them more about it?
Yeah, so let's go to the airport now and hear what they're saying.
Right now, we will summarize whatever that says subsequently to you, but just a quick reminder that a flight carrying about 600 doses of the 600,000, why do I keep saying 600? It's actually 600,000 doses. And the good news is that in the next few weeks, what it means is that at least 600,000 vulnerable and exposed Ghanaians will receive the vaccination, and so 600,000 of us will be free of the virus, and that for me is very good news. But also because we still need to keeping safe, keep washing our hands, using the hand sanitizers, and of course wearing the face mask, and keeping that social distancing we've become used to. There's another statement.
Yes, Abdul. The WHO and UNICEF have issued a joint statement, and that has just been forwarded to me by the Office of the Ministry of Information, and it's saying the heading is Ghana becomes recipient of historic first shipment of COVAX vaccines. And the statement reads, after a year of disruptions due to the COVID-19 pandemic, with more than 80,700 Ghanaians getting infected with the virus and over 580 lost lives, the path to recovery for the people of Ghana can finally begin. This is a momentous occasion as the arrival of the COVID-19 vaccines into Ghana is critical in bringing the pandemic to an end. The only way out of this crisis is to ensure that vaccines are available for all. We thank all partners that are supporting the COVAX facility to deliver safe and effective COVID-19 vaccines to all countries quickly and fairly. These 600,000 COVAX vaccines are part of an initial tranche of deliveries of the AstraZeneca Oxford vaccine licensed to the Serum Institute of India, which represent part of the first wave of COVID vaccines headed to several low and middle income countries. The shipment also represents the beginning of what should be the largest vaccine procurement and supply operation in history. The COVAX facility plans to deliver close to 2 billion doses of COVID-19 vaccines this year, and this is an unprecedented global effort to make sure all citizens have access to vaccines. We are pleased that Ghana has become the first country to receive the COVID-19 vaccines from the COVAX facility. We congratulate the government of Ghana, especially the Ministry of Health, Ghana Health Service, and Ministry of Information for its relentless efforts to protect the population. As part of the UN country team in Ghana, UNICEF and WHO reiterate our commitment to support the vaccination campaign and contain the spread of the virus in close cooperation with all partners, including Gavi and the Coalition for Epidemic Preparedness Innovations, CEPI. Vaccines save lives. As health workers and other frontline staff are vaccinated, we will be able to gradually see a return to normalcy, including better access to health, education, and protection services. In the spirit of universal health coverage, let's leave no one behind. So that was the joint statement by the WHO and UNICEF. Congratulating all parties involved, basically, Abdul, and happy to see that we, the gateway to Africa, Ghana, is the first country to receive the shipping or the supply from the COVAX facility.
Yes, but just to also remind our viewers that but in Africa, Zimbabwe and Equatorial Guinea have already received some vaccines as well, but not from the COVAX. We needed to clear that before people think that we... Yes, but the rollout in Ghana is a milestone for the initiative that is trying to narrow what people call a politically sensitive gap between the millions of people being vaccinated in wealthier countries and comparatively few who have received the shots in less developed parts of the world. Whilst others have received many more vaccines, we are now receiving our very first tranche of about 600,000. And remember, our population is estimated to be about 31 million at the moment. So 600,000 is, even though it's exciting news, it's just like a drop in the ocean for now. And what it then means is that we must, there's still a long way to go. We shouldn't throw caution to the wind, and we must continue to observe all the safety protocols we have so much become used to in the last couple of months. It's almost a year now. We got our first case, I believe, in March. That was on the 12th of March, where 2 cases were imported. Indeed, for a long time, all the recorded cases in Ghana were imported cases until we began to see some form of community spread, and it has gotten worse ever since. As we said at the very beginning, throughout from March until December last year, we had just about 350 or so persons who had passed away. Unfortunately so, but given the figures that we had seen from other countries, where in a day, in countries like the US, about 1,000 people could die. In fact, in one of the days, in the US alone, 1,200 people died. In Brazil, in one day, 900 people died. In Spain, in one day, and I'm talking about not just one day, but subsequently other days, you have 800 people dying, 900, 1,000 in Spain, in Brazil, in Italy. We had 900 people dying for almost 5 consecutive days, Thelma. And so when we had about 300 for the entire 8 months or so, even though it wasn't exciting, we still we were lucky. We said we were lucky. But in 2 months, we've lost as many people as we lost in the entire 2020. That's unfortunate, Thelma.
That is the cause for worry. But Abdul, all is not lost. Hopefully, as we learn more about this new disease and as we adapt to ways to cope with this new normal, some sense of normalcy will return, like the statement from the WHO and UNICEF said. Mind you that in America alone, just over the weekend, they marked the 500,000 deaths in America alone. And they held a ceremony, a minute silence to remember those who had fallen. In the whole of Africa, we've lost about 100,000 people. And that is only a fifth of what America has lost. It is in no way meant to take from the grief that people feel. And I've said on some platforms that COVID-19 has ceased to be about figures and numbers, and it's now people I know, people you know, people who are getting infected are people that you know. Now it's in the communities. You are seeing the people. You saw somebody last week. This week, the person tested positive. You have instances where prominent personalities have come out to say, look, I have tested positive. Unfortunately, we still have stigmatization of persons at workplaces, within the community, of persons who have recovered from COVID-19 being, discriminated against for whatever reason. And that I find very unfortunate, because at least those people have known their status. At least they've tested and at least they've gotten help. But what about those who have not tested and yet they sit in the safety of their ignorance, if I can call it that, to look at those who have bravely gone to test and they have received the treatment and think that they, for some reason, are better off?
I find that very contradictory, that someone goes to test and probably tests positive, and another person who actually declines to be tested begins to stigmatize that person who has tested and is actually not showing any signs and symptoms of sickness and so on, yet you sitting there, you are feeling symptoms, you have some symptoms of illnesses, and yet you haven't tested, yet you are stigmatizing somebody who has tested positive. The person is safer than you who have not tested, and therefore the stigmatization must stop. Indeed, everyone must be encouraged to go out there and test, and if found positive, get some treatment and get everyone else to be safe, rather than staying away from being tested and putting the rest of us at risk. Currently, the cold stores, the mobile cold stores are ready to receive the vaccines. Of course, the Minister Designate for Health and his entourage, as well as the international community here in Ghana have, and representatives from UNICEF and the WHO have all witnessed the arrival of the vaccines, have received them formally, and these vaccines will now be transported to other holding facilities in wait for the president to officially receive them and also be the first to be vaccinated in the country before the rollout plan is actually activated. So the vaccines, 600,000 of them, 600,000 have arrived.
Right. And we can see that as the trucks are being loaded, some of the delegation have started to leave. It tells you that we've come to the end of the official welcoming of the vaccines into Ghana. We are live in the capital, Accra, and we are at Terminal 2 of the Kotoka International Airport, what used to be our international travel terminal until we got a new facility at Terminal 3, and then the international travel was moved to that building. So we've seen Health Minister Designate receive the vaccines with his team from the Ghana Health Service and also the world partners from UNICEF, WHO, COVAX, and all those who have come to support us. Indeed, they have the eternal gratitude of a nation, because finally we may see some light at the end of what had appeared to be a rather dark tunnel. And for those who have lost their lives in this fight, we can never forget what you've had to sacrifice for us to gain knowledge of how to live with this new disease as we go on in the weeks and months ahead. And we cannot also say thank you enough to the COVAX team who have spearheaded this acquisition of the vaccines, because it is very competitive and a lot of countries are fighting to get vaccines. And for Ghana to be the first in Africa to benefit from the facility is really welcome news for its citizens. And we hope that the whole of Africa, indeed everyone everywhere in the world who desperately needs a vaccine in order to be safe and to survive, will get one sooner rather than later. And I'm also hoping...
Thelma, just to cut in there, as you talk about Ghana being the first in Africa, we always need to emphasize the fact that we are referring to the COVAX.
To the COVAX facility.
The COVAX, and not because other countries have received some other forms of vaccinations, but Ghana is the first to receive the COVAX vaccination facilities. That clarification, we need to keep making it before.
Yes, because vaccinations have started in other African countries.
Zimbabwe, Equatorial Guinea,
even in South Africa,
yes.
on the 17th of February, they started some vaccinations. So mind you, South Africa had to get new vaccines so that they can deal with their new strain. So the vaccines are being loaded, yes, and we can see that on our screen. Very historic scenes we are seeing here, Abdul. The end in sight in our COVID fight. Of course,
but again, we keep cautioning Ghanaians that this does not mean that we lower our guards. We are not out of the woods, not yet. And even for those who will be privileged to be among the first to receive the vaccines, it does not guarantee you against contracting the virus 100%. You still need to stay away from all the issues that can lead to a contraction of the virus. And that's what is important, that as much as possible, let's stick to all the COVID-19 protection protocols, even as the vaccines have arrived, and even as the rollout will start after the 2nd of March, when the president initially officially receives them and proceeds to give us the rollout plan.
Yes, I'm excited for particularly, obviously I'm excited for the whole country, but the people who are top of my list is for the frontline workers and all the people in the health sector generally who have been at the forefront of this fight, bravely fighting to protect the rest of us who are now referred to as mere mortals, because those people are heroes. They have saved the country a great deal of human resource, and they deserve every commendation that comes their way. I'm happy that with this vaccination, once they get it, they will have an extra layer of protection, because we know that the distribution of PPEs, from what we've been told, have not been at 100%, and we look forward to seeing the numbers become better, so that as we move on to other things to do in the country later on in the year, we'll be more confident
that's right,
of
Thelma.
safety.
That's right, and even as you will talk about, you have spoken about frontline workers. You recall that when the president initially gave out some incentives to frontline workers, all manner of people came out to define themselves as frontline workers. I just hope that that controversy we experience will not happen this time around, and that the proper definition for frontline workers would have already been put out there for people who know that they belong to that circle or not. Not to come out to create any unnecessary controversies, even as we receive this very exciting news.
Yes, I think that apart from the key people, for me being frontline workers, that I'm excited for the persons in the upper age demographic who have been identified as being vulnerable, so the 60 plus population. I'm excited that my grandmother at home will have access to a vaccine. Your father, your mother, who is advanced in age, will have access to a vaccine. I'm hoping that people would see the benefit of being vaccinated, and so turn up en masse to take the jab, because we've seen other countries where people who have refused the vaccine have been offered alternatives which have been costly. What do I mean, Abdul? A friend of mine who lectures at the university in United Arab Emirates has been told that they needed to get vaccinated or pay for tests every 2 weeks from their pockets.
Wow.
So if you refuse to get the vaccination, you had to pay for the test yourself. And I'm hoping that it will not come to that point, and that everything that we are seeing today will be reassuring to the public, Abdul, so that they will be better informed to go out and be vaccinated. I'm excited at the level of partnership that we've seen here today from our development partners, and I'm hoping that the Ghanaian people would rally together, as we always have, to make this vaccination dream a reality and a success.
All right, and so Thelma, I think that's about it for now. For those who just joined, those are the vaccines getting onto the trucks to be transported to some other storage facilities for the rollout proper to be activated. 600,000 of them arrived in the country about some 30 minutes ago on an Emirates airliner. The Minister for Health designate and other government officials were here together with
There you have it, Ghana receiving her first 600,000 doses of the AstraZeneca COVID-19 vaccines. I mean, it's a great day for all of us to celebrate this achievement as a country.
Yeah. So the last scenes you saw there were the vaccines being moved into cold trucks. This is to make sure that the temperatures are regulated for the efficacy of the vaccines to be maintained at the optimal levels. All right. So I think it's a very good day for us as Ghanaians. And of course, as you heard there, from the COVAX facility onto which 92 countries signed for provision of the vaccine, Ghana is the first country out of the 92 to receive its batch. So fantastic news We're really excited. There's some more messages I've been sending. So Mohammed Izzuddin from Eastern Region, Achimodan, Eastern Region, said earlier that social media puts fear in us, and there are several viral videos moving around. Then he comes to say back again that what I meant was we are afraid, but through this education from Citi TV, we are now convinced. Thank you very much for that clarification, Mohammed.
We have some more messages here. Howard from Palestine says, we thank God Almighty Allah for the arrival of the COVID-19 vaccines in this country. The Christian Council, Muslim Council, opinion leaders, and chiefs should advise their members to go for the vaccines. I think that's a brilliant point there. This is time for all of our religious leaders to get on board to convince all of us to go out there and get vaccinated. Kudos to His Excellency Nana Dodonko Akufo-Addo, the frontline health workers who have been in the soldiers of this battle and who also made this whole process successful. Ayu Farouk from Tamale North says, good morning, Citi TV team. Can the imported COVID-19 vaccines be suitable for Ghanaians? Elsewhere in Africa, the vaccine did not match the body conditions of the inhabitants. So our leaders must be injected first when the vaccine is ready for use for any Ghanaian. Thank you guys so much. And earlier on, we mentioned that the Information Ministry sent out a communique giving us more information about these 600,000 doses of the vaccines that we have. That's AstraZeneca. I'm going to give you a brief information on that. COVID-19 vaccination will be conducted in phases among segmented population. The first segment of the population will receive from the 600,000 doses will be health workers, adults 60 years and over, people with underlying health conditions, frontline health workers, as well as frontline executives, the legislature, judiciary, and related staff, frontline security personnel, some religious leaders, essential workers, teachers, and personalities in the Greater Accra Metro, including Awutu Senya and Awutu Senya East in the Central Region. A similar segmented population in the Greater Kumasi Metro and Obuasi Municipality will also be covered.
Absolutely. Yeah, so the way it is, I think that we are really getting into this. Let me read the last part of this from the 2nd of March. The COVID-19 vaccines will be deployed in health facilities and designated centers in these geographical areas. The government of Ghana remains resolute at ensuring the welfare of all Ghanaians and making frantic efforts to acquire adequate vaccines to cover the entire country. All right. The final part of this communique says, we acknowledge the hard work of the technical teams from Ghana Health Service and the Ministry of Health, the Ministry of Information, the COVID-19 Task Force, and all those who have assisted us in getting this far. Our development partners are also acknowledged for their tremendous financial and technical support. It is our hope that they will continue to support us in our sustained effort in combating this virus and putting COVID-19 behind us. Absolutely. Well, it's been a really good morning. Just having all this good news with the vaccines arriving, and 600,000 is a large chunk, you know. And of course, we know that there's going to be different phases of it. So this is just the beginning. Okay? This is just the beginning. I believe that it's important for all of us to get on board. The education, as many people are saying, you know, through the messages and all that. In fact, there's another message that has just come. It says here, good morning. Will nose masks be worn after the vaccine? Yes, please. Okay, so the Ministry of Health is going to advise us as to, the Ghana Health Service is going to advise us as to when we can finally be safe enough to stop wearing the nose mask until we hear from the Ghana Health Service and from the Ministry of Health and from the Ministry of Information. We are going to be wearing these face masks, nose masks, and still be using sanitizers, washing our hands, and all. And by the way, when the whole COVID thing is gone, the washing of hands and sanitizers is not going anywhere. All right, we still have to maintain hygiene, okay? So that's important. But yes, to answer your question, yes, the nose masks, face masks, they will still be worn. The reason is simple. The population has to be vaccinated in its entirety, all right? The vaccine, remember, is not a cure, it's preventive, okay? So let's not get confused. If somebody already has it, the vaccine is not going to help them necessarily. All right, it's supposed to prevent you from getting it in the first place.